Right. So we will go ahead and begin. We're thrilled to have you join the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature three dynamic speakers representing different organizations who will share the resources, sorry, y'all cannot talk today, they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m., so please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for each meeting this calendar year. Each agency will have 15 minutes to share about services and referrals, followed by 5 minutes for any questions our attendees may have. We ask all participants to remain muted during the presentations. Once we open for Q&A, you can unmute to ask your question, or if you want, you can put it in the chat and I will ask it, or whoever is presenting at that time can also ask it. Without further delay, I'm excited to introduce the three agencies for today, which are People Engaged in Recovery, the Phoenix House, and Behavioral Health Group. So we will go ahead and begin with People Engaged in Recovery.
Hey everybody, I'm Karen Elmore with People Engaged in Recovery. We are a state certified, state funded peer agency in Mobile and Dothan, Alabama. And what we do is we help people who are suffering with substance use disorder find their pathway to treatment. We offer peer support, we get them assessments, and we get them to and from treatment. We also have, in our community centers, we have activities. So we have a pool table, we have foosball, ping pong, darts, all of that. And it's a safe place to hang out. We are open 7 days a week. And sorry, y'all, I'm driving. Sorry. Give me just a minute. I got to turn because I want to park the car. But anyway, we offer all kind of peer services, and we just kind of like to hang out with our peers, take them to meetings, do some things with them. That's pretty much basically what we do. If anybody has any questions, I can answer them.
Hey, Karen, my name is Daryl Lee. I'm the community liaison with New Season Treatment Centers.
Yes, sir.
And we're a MAT and cognitive behavioral
Mm-hmm.
counseling, and we have a clinic there in Mobile. One of the biggest issues that we run into is our patients having transportation from time to time. I would love to hook up with you to meet our program director down there, if you don't already know Dr. Lisa Williams,
I
and
do.
just just work on a community partnership if you're open to that.
Well, I would love to say that we are open to that. However, every now and then is fine. We'll get people
Yeah.
to their MAT appointments. We cannot commit to taking people to outpatient services or
Okay.
daily dosing because we're
Right.
just so busy across the state, you know. So that's really difficult.
Yeah.
But I
What
have
I'm
got,
hoping. Go ahead.
yes, sir. I have gotten with Lisa and Dr. Lisa, and we're going to try and come together and do some things together too. So,
Okay. All right. That's great. Thank you so much. Yeah, because the main thing we like to try to get people, like when they start treatment, to make sure they get there as they work on their own
yes,
transportation and go. So thank you so much for everything you're doing.
yes, sir. It's my pleasure. Thank you. Anybody else?
Yes. What was the name of your group?
It's People Engaged in Recovery, but we go by PEIR and we spell it wrong because it's PEIR. And yeah, it's an acronym, so we get to spell it wrong.
Thank
And we
you.
also have a 24-hour, 7-day a week helpline for anybody seeking services. And that number is 844 307 1760.
Thank you.
Hi, Karen. This is Lee
Yes.
Few. I'm with Wings Cross, Alabama and NAMI, Alabama. And
Mm-hmm.
and I think we have a NAMI support group that meets at the Mobile Pier.
I think you do. I think you do.
Okay, we had discussed it, and I'm the peer program coordinator, and it's embarrassing that I did not know that for sure. But I thought it had started already. We're very excited about that, and I'm going to do a little self promotion right here, if it's okay. We are currently Wings Cross Alabama works with the Department of Mental Health planning our AIR conference every year at Shaco Springs, and it's coming up in April. And we would love to have y'all come and set up an info table and everything at our conference. No charge, just love to have you.
Okay, let me give everybody my email address. It's Karen at people engaged in recovery.org.
Thank you. And that invitation goes to any of your organizations that's on here. If y'all would like to come and set up info tables or do workshops at our conference, we would love for you to. So, sorry.
That's okay. I'm sure
Wait.
this is pretty easy forum here. So yeah, we love to set up tables, and I do a PowerPoint on peer-to-peer services and anything we can do. We love to do it.
I will send out, we're getting all of our registration packets together, and I'll make sure that you get one. Thank you.
Yes, ma'am. Thank you.
Thank you,
Anyone else?
Karen.
You're
Yes.
welcome. You're welcome. Now I can drive now that I'm not talking. Okay, I'm gonna listen, all right?
Yes, ma'am. Thank you. All
All
right.
right.
So now we will hear from the Phoenix House.
Hey, good morning. I'm sorry, good afternoon. My name is Ted Sexton. I'm the executive director for the Phoenix House of Tuscaloosa, and with me is John Tyler, our clinical director. So we're going to try to answer whatever questions you may come up with if you have any. So I'm sorry that I'm about ready to display my terrible technical skills. So I'm hoping that this works properly. And I'm hoping that you all can see a screen now. I hope participants can now see your screen. Good. Will show us the PowerPoint. Okay, there it is. All right. Hopefully you're looking at a PowerPoint.
Yes, we can see it now.
Okay, all right. Well, then let me see if I can get this going here because I have part of the Zoom blocking my. Okay, we'll just, since I can't get to the beginning of the slideshow, we'll just do it this way. My apologies. The Phoenix House is 52 years old. We have a partnership ongoing with several different entities here in Tuscaloosa that include Shelton State Community College, and the Alabama College System, the Department of Labor, Watley Health Services, the Chamber, and the United Way of West Alabama. We are 3.01 state certified facility. We will go up to, in October, we're raising our level of care to 3.1, and we'll terminate the 3.01 as we move forward. We're here in Tuscaloosa, Alabama. We serve folks from around the state, and I'm trying to pull up your list of questions that you have here. Just one second. So we go through that, but as I said, a 3.01. And if applicable, what levels of care does your organization provide? 3.01. What other information would you like to share? We'll go through a quick PowerPoint, and then best practices. We're going to talk about a program that we have here that has been extremely successful and helped us increase our level and our percentage of folks that complete the Phoenix House program, the 12-week program. one of the questions that we generally get is why do we need the Phoenix House here in Tuscaloosa? And roughly 10% of the population is affected by substance and alcohol dependency. Tuscaloosa is no different than anywhere else in the world. I was a cop for 40 years. I worked here in Tuscaloosa. I was the sheriff in Tuscaloosa, and I finished up as the chief of Homeland Security in Los Angeles. But I can tell you that we just see the same problems that they do in Los Angeles. We just don't see the sheer numbers that they see in that area, but it's no different. We're seeing the same issues. About 40% of our issues are methamphetamine, 25% alcohol. I think 17% was our last review on opiates, 7% cocaine, 7% cannabis, and another 2% in the hallucinogens. Everybody in this room knows that the issues that are caused through substance abuse disorder and the issues that we're trying to deal with crime, poverty, child abuse, domestic violence, divorce, jail overcrowding, and breaking cycles. So we've been working very closely in partnership with both the city of Tuscaloosa and Tuscaloosa County in some of these programs that we'll be talking about here in just a minute. We offer a comprehensive treatment program. We have agreements with everybody and their mother, from medical to mental health to the University of Alabama being in our backyard. We have a psychology department, nursing, so on and so forth. But I'm sorry, Vital is hosting this, so we have to give the University of Alabama their due diligence.
Yeah.
My hands across my heart. I'm an alum.
Roll
I'm
Tide.
sorry our football team didn't do well. We'll stay Roll Tide. But to save time, there are a number of partnerships that we have with the University of Alabama, and we're very appreciative of those partnerships. These are some numbers regarding our admissions when folks are coming in, and then we'll talk about our discharge at the bottom. But roughly 83% of the folks walking in the door here are unemployed when they come in. 40% don't have a GED or high school diploma. 87% are unmarried. 90% of our females are reporting domestic abuse, sexual abuse, or other abuses. 70% of our clients have children. 73% are below the poverty line. 80% under court order. 90% don't have an independent living plan when they walk in the door. And of course, our goal is to try to help them change as many of these as we can. The biggest problem that we see with what we're asked to do, if anybody saw, Maverick Top Gun, he said your greatest enemy is time. And time is our greatest issue to try to make change or at least try to help folks in their substance abuse disorder and oftentimes their behavioral issues in 12 weeks is nearly impossible. However, we do see, we have a program here that we run. We started in conjunction with Shelton State and the Department of Labor, which is the Ready to Work program. Since we've implemented that program here and folks have the opportunity to take it, we saw our percentage of folks who successfully complete the program go up by about 15 to 20%, which right now it's about 70% of the folks that come through are actually completing the program. When they go of that 70% going out the door, 90% are employed full-time with benefit. So we, again, have a very robust program for the Ready to Work program, but also a very robust employment program to help these people get their job. Of course, they come in and they go, how do I pay for this? How do I get little Johnny this and that? And we talk to them about not stealing and getting a job and doing it the way that they should as they integrate back into the community. Again, it's trying to deal with those behavioral issues. 80% of our folks, as I said, come in through the courts. So we get some very unique individuals that come through with some ideas about how they should obtain property and hopefully not take yours. But we've been very successful. Nobody's been arrested while they've been here. I keep knocking on wood every day. Every time I see a patrol car, I'm waiting to see them drop somebody off out of the back seat, unfortunately. We 99% are reporting improved legal status. We concentrate very heavily on trying to deal with the courts and the CIROs to try to make sure that oftentimes when they come in, they're getting behind in the legal system. And once you get behind in the legal system, as we all know, it's very ugly and it's very difficult to deal with. So that's one of the areas that we concentrate on with case management, is to ensure that they know exactly where they are in the situation. what they owe, what the fines are, that they understand what the system is, because most of them don't understand the legal system. So we do our best to try to make sure that they understand where they are today, what they need to do going forward, and how they avoid the long arm of the law throwing them back in on a court order or something that they failed to do. 100% report participating often in recovery activities, and 100% report that their connection to the recovery community is better, and 100% have been screened and offered an opportunity for individual therapy services here. The one thing again that we're seeing is time. And if you're an Auburn fan, I apologize, but Coach Saban gives a lot of what we call Sabanisms that are apropos to the substance use disorder community. And one of those is the pain of disappointment and the pain of discipline and the pain of disappointment. So we try to get them to understand what the difference between those two are. I'm sorry.
I'm sorry.
That they
I'm sorry.
understand, so that they understand what we're trying to do in regards to help them out in their behavioral changes that will help them reintegrate, hopefully stay away from the criminal justice system and other issues that are out there that are hanging over them, and be able to move forward in their recovery. The one thing that we're seeing, I'll touch base on that just a little bit. Sorry. We're going to move on to the next one here. We're working on the independent living plans formulated by the Phoenix House for folks coming out of there. In 2022, of the folks that came through, we placed 184 folks that came through that said they did not have an independent living plan, that we got them into some sort of housing. And in 2023 was 203. We generally put our statistical data together when it's time for the United Way allocations. So I haven't done it yet this year, so my apology. Our waiting list is showing 647. So this is an old one. I apologize. That was, we're down to, I think, 234 now. So, all right, the next one. We basically try to deal this in 3 steps. So Phoenix House, the 12-week 3.01 program. We have a sober living program. The difference in ours is there's still case management over there. They're still meeting. They're still coming face to face with case managers and others. We just find this accountability and helping their responsibility as an aid in helping them in their recovery. So that would be our step 2. And then we're looking at a proposal to create an independent therapeutic community here in Tuscaloosa that would actually be a 30-month program. So that is something that we're looking at down the road to create. So, y'all are very familiar with the 3-step goals and what we're trying to do. So I certainly don't want to burden you with that, but I also pulled up the wrong PowerPoint, John. I came through. I'm showing my lack of skills again. So these are some of the behaviors that we want to talk about that also relate back to substance abuse disorder, which would be the criminal selfishness behavior, lying, manipulative behavior, so on and so forth. And then, everybody's aware of that. I'm sorry. But these are the other things that we try to concentrate on as we deal with them, about responsibility, being 200% accountable, impeccable honesty with both themselves and others, decision-making, boundaries, conflict resolution. So there's plenty of discussion items that we can deal with both in peer groups, case management, and throughout the process here. And so during that 12 weeks, these are throughout the program. This is a consistent message that comes through from all of our case managers, from all of our staff, is about how to improve upon these entities right here. So I'm pretty much going to leave it there. I pulled up the wrong PowerPoints, which is my problem. And so I'm going to revert back to answering any questions you may have, and John Tyler, our clinical director, can also try to answer any questions you may have.
Mm-hmm.
No questions. That's great. Thank you.
I'm not sure if you had mentioned it, but how long would you say people typically spend in the treatment house?
Phoenix House is a 12-week program.
12-week program.
You can ask for an extension for an additional 4 weeks, up to 16, but generally folks are here on an average of about 90 days. And then, as I said, can ask for additional treatment. And if you're basically on the honor roll, then you have the opportunity to go across the street to our sober living program, which again continues a case management program.
Thank you.
since y'all didn't kick me out for inviting everybody to our conference, Mr. Sexton, I'm one of the state trainers for our CIT program. And since you said were a former sheriff in law enforcement, I'm sure you're familiar with CIT. We do quarterly trainings in Tuscaloosa, and on the second day we have a resource panel where just any interested entities can come and give about a 10 or 15-minute talk about what they provide in the community. And we would love to have someone from Phoenix House come and do that.
John Tyler would be a wonderful speaker.
Love
Anytime.
how you threw him under the bus right there.
He has better technical skills than I do.
Well, and you can come in person. We do it at the APOST Training Center, or you can Zoom in and do it. And we have law enforcement from not just from Tuscaloosa, but from surrounding areas. So probably most of Tuscaloosa law enforcement know about you and what you do, but the surrounding counties might not be as familiar. So I think that'd be a great way to get word out to other areas. So I put my email address in the chat. So y'all reach out, and we've got a training coming up next month, in fact.
John, Jon. Tyler at phtcl.org. He's a great speaker. I'm sorry that you're having to hear me today, but John's better.
Thank you. I'm going to try to sit back and be quiet. That's not my strong point, but I'm going to try.
No problem at all. I love it. At least everyone's getting involved.
And to access our services, we need a state drug and alcohol assessment, ASAM assessment, assessed for a 3.01 right now. And we'll be transitioning to a 3.1 low intensity program in October. But as of right now, we're 3.01 transitional. But to access our services, please send us a ASAM assessment assessed for our level of care to intake at phtcl.org with any corresponding information with the assessment to access our services.
Can you drop that in the chat, please?
Sure, we'll find it. We'll find it here in a second.
Yes, I can put it in there.
We'll find it here in a second. But we really appreciate the time, everybody. Thank you.
We apologize. Both of us are highly skilled technicians. Normally when we're on a Zoom call, we're listening to somebody else. We're not normally doing the presentation as we do every Tuesday morning.
I think y'all did a great job.
Okay, thank you. We dropped it in here as it should.
And then you said it was intake at Phoenix House, Tuscaloosa?
No, it's intake. It's intake at phtcl.org, and we'll put it in the chat.
Okay, thank you. All right. Thank you to the Phoenix House. They'll drop their emails in there for you guys to reach out to them. So now we'll hear from our last group, which is the behavioral health group.
Well, good afternoon, everybody. Some of you all I am familiar with, where I'm not with others, but I am Cherie Millsap. I work for a behavioral health group, which is known as BHG. We have 11 locations in the state of Alabama, and so I'm here representing Tuscaloosa. I am our regional outreach coordinator for the state of Alabama, Louisiana, Maryland, and DC. And so my role within the company is to go out and just to build those partnerships. So being on this call is a great way for me to do that with some of you all that I have not met. But with BHG, what we do, we provide services to individuals that suffer from substance abuse. We provide treatment and counseling. And so with that, we are outpatient. So we're open 7 days a week where our patients and individuals who are needing our services are able to come in every day. They do not need an appointment. They can walk in. Again, 7 days a week, outpatient, and based on them coming in, I'm not sure if everybody is familiar with us, but for those that are not, if there are any patients or anybody in your community that can benefit from our services, With them coming in, they will have an assessment done. They'll be able to meet with our doctor, our nurses, our counselors, and even our program director that's on site to find out their level of care. And for any reason, if we cannot meet that level of care, they need a higher level of care to where they need to be go to an inpatient facility, we will assist them with getting into that. So they won't come to us and we turn them away and leave them out there to find resources for themselves. We will walk that journey with them. With my role within the company, I love talking to any and everybody about our services and being able to meet people who have came through our program, came through our treatment facility, whether they're still there for a longer length of time or those who were able to walk away and not need us anymore. I think it's a big thing to be able to see or to hear from people because our biggest referral comes from word of mouth. And I think for me, it's real big to see people come in to know what their journey was before treatment, during treatment, and after treatment. And I don't know about you all, but for me, I have this running joke to where I'm like, we watch TV, we see the commercials, you see the different actors that's on there advertising different businesses. And a lot of times I'm like, are they real? Did they really, do that? Or are they just getting paid? And so, but to actually have patients that can give their story and give their testimony, I think that's huge. I love what I do. And I tell anybody, you cannot work in healthcare or on the criminal justice side and not have a passion for people. You can't do it just to get a paycheck. You really have to have a love for people. And I'm real big on helping people. And so within BHG, outside of us providing treatment, and counseling for those patients. We also have our counselors also offer case management services. So any patients that's coming in that do not have a place to stay, do not have a place to work, have employment, or any other services or resources they can benefit from for their day-to-day life, we assist with that as well. So outside of me just going out trying to partner with different people to where we can bring in referrals, I also like to partner with those where our patients can benefit from their services as well. And so with that being said, outside of with our patients, we may have, we take all forms of insurance. So if we do have patients that do not have insurance or cannot self-pay, we have grants available that will cover the cost of treatment. And so we try to cover every aspect of that treatment side and counseling side. So there's really like no excuse for a person who's really needing assistance and needing help. We'll have that covered for them. Now, with the grant piece, anybody that comes in that needs to be put on the grant, we will do an application for Medicaid to get a true denial on that. Because again, we know some people do not fully know how to fill out those applications correctly. So our counselors and our staff at our BHG locations will assist them with that, get that true denial. They'll be able to be put on the grant at that moment to have treatment covered. Also with that, normally we try to keep them on for a minimum of 6 months, but it can go a little longer just based on their needs and what's taking place with them, which comes into play with them meeting with our counselors, So we do group counseling, we do individual counseling. For some of our locations, we are starting IOP as well, but that's not offered at all of our locations. Again, within our company, we have 123 locations. Within the state of Alabama, we have 11. Tuscaloosa will be one of our locations. Also, we have Bessemer, Coleman, Shoals, Huntsville, Stevenson, Gaston, Grand Bay, Mobile, Montgomery. And we also have another location in Mobile. Within the 11 locations, 9 of those are treatment centers, while the other 2 are like our medical service locations, where they just provide strictly Suboxone for those patients where they come in and get their scripts. They meet with the doctor, have those scripts written, and they're coming in once a month to get those filled. Our treatment centers offer both methadone and Suboxone. And we are looking at branching out to different other services as well. And so a lot of times I get the question outside of MOUD services. Yes, I'll definitely put my contact information in for you all to have. But outside of the services we provide, we are doing counseling only as well. So if you do have or know someone, which I run across people all the time that stating that they're in recovery, they don't need the medicated medication treatment, but they're needing that counseling piece. So we are able to offer that as well to the community, to those patients that's coming in. I want to make sure I'm letting you all know everything. And I love to talk because I love my job. So, Leah, you make sure I'm not going over time. So, but with that, one thing that I do when I go out and even speaking with you all, I always encourage anybody that we're trying to partner with or just trying to build a relationship with, you're welcome to come take a tour of our center. Because if you do have people that you want to refer over to us, I'm real big on, I'm going to definitely be honest and tell you the truth about our services and who we are. But I think it's better when you can come and see for yourself the type of environment those individuals will be walking into, along with the staff and the employees that will be there that will be assisting them on a day-to-day. The only thing, if you would like to come and take a tour, we do wait and do those after our dosing hours, just to kind of stay within that HIPAA regulations and make sure, we're not invading anyone's privacy and stuff with them coming in. Within our company, we treat about 42 and maybe a little over 42,000 patients a day. And that's with all of our locations combined. However, with our Tuscaloosa location, that location alone sees anywhere between 400 and 500 patients a day that's coming in being treated. And so to me, that's huge because, again, you have people that are taking this seriously, and they're trying to make a change for themselves. And so a lot of times we know it's a stigma out there, about substance abuse and those that are coming in doing treatment, whether it's inpatient or outpatient. And that's one of my things that I like to, go out and kind of educate people on and give them that information. Because it takes a lot. I haven't had to personally deal with substance abuse, but just to know people and just to see people I work with, well, not actually work with, currently now, but, the patients that's coming in. It takes, for me, I feel like it takes a lot for a person to get up every day to come to treatment. And we open as early as 5 a.m., some of our locations as early as 4:30 a.m. Again, this is every day, Sunday through Saturday, that a patient can come in, an individual can come in to get assistance, to get treatment, to start that process. And so to have people coming in every day to get those services and then leave to go to work, just to still be out on a day-to-day, living their life and still being responsible on that end to make a change in their life, that's huge for me. We all are faced with different things. And I tell people all the time when I go in and talk, whether it's a doctor's office, whether it's a judge or police officers. I just recently, Mr. Sexton, I just recently came from Mobile talking with the police department there, and we're scheduling another meeting for me to talk with the officers. But just to kind of make everybody aware when people come in, because a lot of times people feel like, they just create this stigma around people. And I tell anybody, I don't think nobody woke up saying, I'm going to do drugs today and I want to have my life messed up. We all have different things that we're faced with that could trigger certain things for that type of disease to attack our life. And so, and outside of just them, their families are having to deal with that as well. And so I've come in contact with so many people outside of just getting the referrals from them. They're having their own family members, or they're pulling me to the side saying, hey, I have a cousin, I have a friend, I have a father, who may need your services, where we're there trying to talk to them about people that they're seeing is coming in every day at their place of business. And so my goal is just to talk to any and everybody who can benefit from it. And I'm grateful for this opportunity because I do feel like even though we all come from different walks of life and we come from different backgrounds as far as our occupation, we are still trying to make a difference as a whole in our community. So we all need each other because what may work for one may not work for the next person. And so I'm all about supporting everybody. So even those that I am familiar with on this call, I know we've done some partnership with Phoenix House in Tuscaloosa. I met Mr. Lee at a conference. A couple of months back in November in Orange Beach. And so we talked, and I think it's a few. I know I've partnered with different other NAMI organizations in Alabama, Miss Leah. And so I'm excited to talk to everybody after this call and to set up meetings and times. But if it's any information I can send over to you, I will be glad to do that. And again, regardless of what area you're in, you can come visit any of our locations. I'm actually based out of Birmingham. So our closest location for the Birmingham area would be our Bessemer location, and that would be closer for Tuscaloosa too, because we do sometimes see residents from Tuscaloosa come to Bessemer and vice versa. So it would be up to them, even with their level of care as far as the type of medication they would want to be on. The patient does have a say-so in what they want to be on with the assistance from our doctor and the nurses and the counselors, them coming together. But we are all about that wraparound service and just trying to make sure outside of just the treatment and counseling that the patient has everything that they need to be able to live a life day to day and, get through this journey. Do anybody have any questions for me? Okay. Well, that's a good thing too. I've enjoyed everybody on the call as well, but I make sure all of my contact information is in the chat. And if you all need me to send over any type of information, documents, or all of that, I'd be willing to do that to your email.
Thank you, Cherie. All right. So we will go ahead and wrap up. Thank you all for joining. We hope you're able to learn something new about a resource available to you in Alabama for treatment and recovery. Please join us on February 5th for our next virtual meeting and have a great day. Thank you, everyone.